How do I understand prognosis in my colon pathology report? When you receive a colon pathology report, it might look like a lot of complex medical language, but understanding the key details can help you grasp what your diagnosis means for your health. Your report is a detailed document created after examining tissue from a biopsy or surgery. It provides important information about the tumor and surrounding tissues that can influence your outlook and treatment options. One of the most important parts of the report is the tumor stage, which is often described using the numbers T, N, and M. The T stands for tumor size and how, for it has grown into the layers of the colon wall or beyond. A small, localized tumor usually has a better outlook than a larger, more invasive one. The N indicates whether cancer cells are found in nearby lymph nodes. The more lymph nodes involved, the higher the chance that the cancer has spread, which can mean a more serious prognosis. The M shows if the cancer has spread to distant organs, such as the liver or lungs. The presence of metastasis generally indicates a more advanced stage and can influence treatment choices. Another key factor is the histologic grade, which describes how abnormal the cancer cells look under a microscope. Well-differentiated or low-grade tumors resemble normal cells more closely and tend to grow and spread more slowly, often leading to a better prognosis. Moderately differentiated tumors are somewhere in between, while poorly differentiated or high-grade tumors look very abnormal and usually grow faster, suggesting a more aggressive disease. Your report will also mention whether the tumor has been completely removed, called negative margins, or if cancer cells are present at the edges of the tissue, called positive margins. Negative margins are a good sign because they suggest no cancer was left behind, reducing the risk of recurrence. If margins are positive, additional treatment might be needed. The report may also note whether cancer has invaded small blood vessels, lymph vessels, or nerves near the tumor. This is called lymphovascular or perineural invasion and is associated with a higher risk of spread and a less favorable outlook. The way the tumor grows at its edges, whether it infiltrates into surrounding tissues or remains well-defined, can also give clues about how aggressive it is. Molecular testing, such as checking for microsatellite instability or specific gene mutations like KRAS or BRAF, can provide more personalized information. Tumors with high microsatellite instability often have a better prognosis in early stages and may respond differently to certain treatments. These genetic details help your healthcare team tailor your therapy more precisely. Putting all these pieces together, if your tumor is small, has not spread to lymph nodes or other organs, and shows low-grade features, your prognosis is generally more favorable. Conversely, if the tumor is large, involves lymph nodes or metastasis, and has high-grade features, it may require more intensive treatment and may carry a less optimistic outlook. Remember, each person's situation is unique. Your healthcare team, including your oncologist and surgeon, can explain what these findings mean specifically for you. They can help you understand your individual prognosis and discuss the best treatment options based on your report. Keep in mind that prognosis is an estimate based on population data and tumor characteristics, but individual outcomes can vary widely. Always consult your medical team for personalized advice, and use this knowledge to be an active participant in your health journey.